just hot in here. And I'm not trying to have a mass rush to outside on the patio, but that really looks good. Thank you, Michael, so much for all you've done for tonight's event, but also for our community. I'm grateful for the board and the employees, and we're grateful for you and what you do every day in supporting us. You're here tonight because you're friends or supporters of the clinic. You're here tonight because you're a patient or an employee or a volunteer. But most of all, you're here tonight to learn more about what it means in our future as a health center. And some of you who don't work in the healthcare area or aren't in law or some other profession that is involved in healthcare or healthcare reform, you might be wondering what exactly a health center is. And we get this question often, actually. We got it today in a staff meeting, so that should tell you the work's never done. The simple way of looking at it is a health center is a place for community members to seek ongoing primary and preventive care. Okay? A health center offers a wide array of services beyond what's typically offered in a physician's office or in a hospital-based clinic. And a health center is also an important part of the community that it serves. But the single most important characteristic of a health center is the quality of its care. And I want to repeat that. The single most important characteristic of a health center is the quality of its care. And so tonight we're making a strong public statement about our role in the community. It's one that's been unfolding for about 5 years if you've been following us. And that statement is the following. That Whitman-Walker is as concerned about how we serve our patients as we are concerned about who we serve as patients. Okay? We are a full-service health center now, and we can serve any community member. We want you all to spread the word about that and help us get that message out. There's a reason for that. I think the simplest way to look at it is that quality of care and having access to quality care transcends any individual population. Gay, straight, positive, negative, black, brown, white, male, female, trans. It doesn't really matter. It's a basic human right from my perspective, and that's why the clinic is such a special place in the community. I also believe as a health center that our historic commitment to the LGBT community and people living with HIV is best served as a health center. And that by providing ongoing, basic, high-quality care, we can do a better job in honoring our roots. And those are roots that are powerful, and those are commitments that we will always, always uphold. So what are we going to do to educate more people besides those of you who joined us tonight? Well, tonight we're launching a new campaign to rebrand Whitman-Walker. And the centerpiece of that campaign is our new name and logo. Okay? If the orchestra did drum rolls, that's great. So you guys want to drum rolls? Go ahead. So, ladies and gentlemen, Whitman-Walker Clinic is now... Yeah! So, it is a new, a fresh logo. It is clearly a new name. It is clearly, it has 3 really important words underneath our name, and I'm going to say a little bit about each one of them. First of all, the new name, from our perspective, best highlights what we are as a health center. It conveys the word health first and foremost to anyone who ever comes and visits us, whether they cross the threshold of one of our clinics, come to a website, call through our call center, or even just see one of us in the community. It conveys primary and preventive care, and it talks about health. It's not about sickness all the time. It's not about one condition. It's not about one community. It also reflects the fact that we care first and foremost about what we do and how we take care of people. And that, quite frankly, that foundation is quality. You'll note the new logo, which, quite frankly, I'll go off script for 1 second. It's Alex Slater or Gardner Lapham in this room or in another room. But I want to recognize Alex and Gardner. There's Alex. Alex and Gardner led a charge of the board of directors for about a year, which is to really look at our brand and did where we are now and where our future is as a health center, did our name convey it? And did the materials and information we were sending out to the community convey that? And the short answer was it didn't anymore. And I give them a lot of credit for taking the courageous leadership role of working the board and the rest of us through a process to really come up with this. I also want to credit Ashley Clark. I don't know, is Ashley in here? I don't know where Ashley is. Where's Ashley? Ashley is the person who designed the logo. And so, great talent in house. So, a brief word about the logo. It represents past, present, and future. It maintains our 2 W's that, according to Ruth Eisenberg, have been around since 1990, and we have not updated since then, so way to go, Ruth, for helping us tonight. It clearly continues our namesakes, and Walt Whitman and Mary Walker, and those 2 pioneering human beings of the 19th century. It uses color to reflect the diversity of our patients. And then it also highlights through the triangle the commitment around community caring and quality. So we feel really strongly about that and how that represents who we are now as a health center. So this isn't one splashy thing. This isn't solely a marketing or a gimmicky thing. This is who we are now. Refer to us as Whitman-Walker Health. Refer to us as our health center. Please don't use clinic anymore because you're not helping us tell the story. Okay? So what are we going to do outside this room? Well, we're about to start about 9 months of a really interesting community education campaign, which will have all kinds of print and TV ads. It will have some radio spots. You'll see a lot of it as you go through the different media, whether it's the gay print media, you'll see stuff in Post, you'll see stuff all over the place. So really interested to see what kind of feedback you can bring that. And so what we're going to do first, and this may take a split second, Chip is going to try to help us. We're going to preview our first item in the campaign, which is a short TV spot that's going to air in early May. This is a good time to pay attention to the screen.
We got him into regular care.
We worked with her to take her medicine correctly.
We helped him get public benefits.
Whitman-Walker Health, community caring quality. Call 202-745-7000.
We have a multi-talented staff, by the way. Our employees are wrong, and they're not shocking you. Another big part of the campaign is clearly a new website, and we're really excited about this. Any of you who have tried to access service through the clinic know that we have a website that is 11 years old, which puts it in the Jurassic period from a technology perspective. It actually doesn't interact with you. It says I don't want to interact with you. So tonight we actually are debuting our new website. It'll be www.whitman-walker.org. If you type in our old website, wwc.org, it's going to roll you forward. So lose that again, whitmanwalker.org, and Chip's going to preview a page of that now.
It's already up.
Oh, you want it? There it is. Okay, good. And I would encourage you, if you have an iPhone later on and you don't want to talk to who you're standing next to, go to the website. Take some time to take a look at it when you can, okay? We've set up, I think, in each one of the rooms there are laptops if anybody really wants to peruse the page, and I would welcome you to do that. And last but by no means least, on behalf of the entire Whitman-Walker family, I thank you for standing with us along this journey. It has not been easy, as many of you know. But most journeys that are not easy are also really well worth it. And I will tell you what we have now I could not be prouder of for what it will do for the many patients who we haven't even met yet. So it's now my pleasure to introduce the chair of our board of directors, David Messing.